Lewy body dementia, or LBD, is a brain disorder that can cause problems with thinking, movement, mood, and behavior. In LBD, abnormal clumps of a protein called alpha-synuclein accumulate in brain cells. These clumps are called Lewy bodies. They cause brain cells to stop working correctly and eventually die. What causes these changes in the brain is not yet fully understood. While LBD typically begins at age 50 or older, sometimes younger people may develop the disease. LBD is a progressive disease, meaning symptoms start slowly and worsen over time. LBD symptoms vary widely from person to person, but often include changes in memory, thinking, mood, behavior, sleep, and movement. Common thinking-related symptoms of LBD include unpredictable changes in concentration or alertness, trouble multitasking and problem-solving, problems with visual and spatial abilities, such as judging distance and depth or misidentifying objects, and seeing, hearing, or smelling things that are not there. Memory problems are also common, but may not be noticeable early on. LBD can also cause changes in mood and behavior. These changes may include depression, a lack of interest in normal daily activities or events, anxiety, agitation, and restlessness. Sleep-related symptoms of LBD may include acting out dreams while asleep, sleeping too much or too little, and certain sleep disorders. Some people with LBD develop movement problems. Symptoms can include tremors or shaking, muscle stiffness, and balance or coordination problems. If you are experiencing changes in your thinking, movement, sleep, behavior, or mood, talk with a doctor who can help you figure out if you have LBD. There are two main forms of LBD: dementia with Lewy bodies and Parkinson's disease dementia. In dementia with Lewy bodies, people have a decline in their thinking skills that may be difficult to diagnose at first. Over time, people may develop other symptoms that make it easier to make an accurate diagnosis. These symptoms include hallucinations, movement problems, and sleep disorders. Parkinson's disease dementia is another form of LBD. Parkinson's disease is a movement disorder that worsens over time. Some people with Parkinson's eventually start to experience changes in their cognition. This is called Parkinson's disease dementia. However, not everyone with Parkinson's will develop dementia. Seeking an accurate diagnosis early on is important. It can lead to more tailored treatments and help families understand and plan for a future with the disease. LBD cannot be prevented or cured, but changes to make the home safer, equipment to make everyday tasks easier, and social support are important. Additionally, medication, physical therapy, and counseling may help manage the symptoms for a period of time. People with LBD may also be able to join clinical studies where they can get support and learn more about the disease, while helping scientists better understand how to prevent and treat LBD in the future. Scientists need people with LBD, their caregivers, and other healthy adults to volunteer for research. To learn more about LBD and participating in clinical research, visit alzheimers.gov/LBD.